Yesterday, the President hosted a healthcare summit at the White House that I was privileged to attend. I thought it was a very good start for this very important debate we're going to have here in the Congress, which we believe and very much hope will lead to enactment of major healthcare reform this year. The President brought to this summit not only people from the Senate and the House of Representatives who are going to have to actually vote on these provisions in committee and on the floor of the two houses, but he also brought representatives of all the interest groups, the insurance companies, the physicians, the healthcare providers, hospitals, all the groups that have a keen interest in this. He got them all in the same room and talked about the issue in great depth. Now, the President is somewhat unique among politicians in his very serious and in-depth grasp of this subject. I think he's spent a lot of time on it. He knows the issues, and it became clear to everybody there, if it had not before that summit, that the President is intimately involved in the subject and wants to do the right thing. The two goals that I think everyone agrees upon are how do we provide for coverage for all Americans, and also how do we control the growth in the cost of health care. Clearly, the cost of health care has been going up at way too rapid a rate compared to the rest of the economy. Unless we can find a way to control that, we're not going to see our budgetary problems resolved. Families are not going to be able to afford health care in the future. Businesses are not going to be able to afford their portion of the cost of health care. So that was a major focus of the session as well. And I hope this leads now to the hearings that we're going to have here in the Senate. In the Finance Committee, we're going to have a series of hearings and hope to actually be able to produce legislation this summer that the full Senate can consider.